Hi, all right, so we're explaining how to draw up and administer your testosterone. We get our blend from a compounding pharmacy called Civic Center. So you'll get your baggie. Your dosage will be on the front label, but you pull the vial out, right, of the bubble wrap, obviously. You can use a pair of scissors. I, in the office, have hemostats, but there's this little middle piece here that we'll take off. And then if they gave you injection supplies, which is something that you will have ordered, then you're gonna get two sets of needles. One will be the 25 gauge. It may not be orange colored like this, but it's 25 gauge. That's not the first one that you use to draw up your testosterone. This is a slight difference in my office as well. So instead of using the other needle, which is an 18 gauge or a thicker one, it's the one that's gonna look a little scary. That's the one that you use to draw up your testosterone. But in the office, when you get your injections done, we give you vial adapters that will go in. That part pierces through the rubber here, okay? And then this stays on the vial the whole time that you use it. You should have received also 1 cc syringes or 1 milliliter syringes. You pop that open, take your alcohol swab, again, swab the top, and you're gonna twist this on. You can turn the vial upside down so that all the liquid goes to the bottom of the vial. And then depending on what your dosage is, you'll pull back the plunger. And it's okay if you do a little bit of push-pull to get some of those air bubbles out. But we'll find your dosage. You twist it off. Put the 25 gauge needle there. And don't forget to prime your needle, which means push the plunger up a little bit until you see just that slight little, I call it a bloop, of solution that comes out of the tip of the needle, okay? Now, our lovely handy dandy patient, you can inject testosterone by yourself. You don't need someone to do it. But if you're going to do it, then you want to focus on the area of the deltoid here. So this whole muscle, anywhere in here is nice and safe. You do not need to bury this needle. Just about halfway is fine. But of course, it's going to be difficult to tell, you know, are you this far or this far? Burying is also safe, but you don't need to. An alternative location to inject would be your thigh. And another alternative would be your upper outer glute. Here we go with the injection. Push the plunger down once you've pierced through the skin. I do a little scratching technique just to help them not feel it. Did you feel it?
I did not.
Okay, good, that's good. We didn't pay him to say that. And that's all. Of course, you can put your needle cap back on the needle and then dispose of them appropriately. That's how you administer your testosterone.